Good morning, everyone. I'm Sarah Hubbard, Executive Director of Sustainable San Mateo County. I am so happy to have you here today to learn about SSMC's new sustainability dashboard and how data can provide insights that lead to sustainable and impactful local policy. This morning, we're going to hear from our keynote speaker, Dr. Kismet Baldwin-Santana, about how San Mateo County has used data to set public health policy. Then we'll introduce you to the new sustainability dashboard and share a few ideas for how you can use it in your own work. We'll also learn about the data-related challenges and successes of a few other community organizations. First, I'd like to introduce a few of you to, or all of you, to a few of the people who have been instrumental in making today happen. If our staff could stand up briefly. I think Jill is probably, thank you. Jill is also probably working on check-in. She's been instrumental. If you're here and you're a member of our board of directors, please stand. Thank you so much. Thank you so much for your continued support and your ongoing guidance. Also note that we are looking for a new treasurer. So if you are interested, talk to me after the presentation. If you're here as an advisory board member, or if you're a volunteer for SSMC, please stand. Anybody here? No? They are also instrumental in the dashboard program. I'd also like to get a sense for who's here in the audience. So if you are an elected leader, could you raise your hand? Thank you for your service and for being here today. If you are city or county staff, lots of you guys, thank you so much for being here. If you work for a nonprofit, thank you so much in the county. What about volunteers for nonprofits? Lots of you guys. We could not do this work without you. And finally, if you're joining us here as a community member and not part of any of those other groups, we got a couple of you guys too. Great. Thank you for being here. It's really nice to see what a diverse group of people we have here in the room, and also know that we have a shared interest in creating a more sustainable county. So SSMC is a nonprofit organization that has advocated for a sustainable future for everyone in San Mateo County for more than 30 years. Our work is guided by the 3 E's of sustainability: the economy, the environment, and social equity. We educate the community and collaborate with local governments to inspire individual action and local policy adoption across a broad range of sustainability topics. So Maya Angelou once said, "Do the best you can until you know better. Then when you know better, do better." SSMC's core programs are really designed to help all of us and our communities both know better and do better. The Sustainability Dashboard, which we'll introduce to you today, is all about knowing better across a very broad range of topics linked to community sustainability. The Indicators Report presents a deeper dive into a single topic each year with recommendations to address those local challenges. And when it comes to doing better, the Sustainability Ideas Bank is here to help you. This compilation of successfully implemented solutions helps government and community leaders quickly advance their sustainability goals. Each of the policies and programs is carefully researched and vetted, and all are relevant to the needs of San Mateo County communities. Finally, our annual Sustainability Awards event recognizes the exceptional work of the many knowers and doers in our communities. Their measurable impact really inspires further action. Each of these programs has its foundation in data. And according to a survey by the Data Literacy Project, only 1/3 of all workers is comfortable with their data literacy skills. This can really be a challenge for us when we're trying to use data to advocate for local policies. Before we go into the details of the dashboard, I want to provide an example that connects how we can gain insight from data and use it for maximum impact. Does this look familiar? Like many of you, I wear a fitness tracker. It's amazing how much data this little device collects. My steps, calories burned, hours of sleep, heart rate, more than that. At first glance, each of those metrics might seem insignificant on its own. Knowing my heart rate at a particular moment or the number of steps I've taken today, it's interesting, but not particularly meaningful on its own. However, when I look at these metrics together, over time, I begin to see a story unfold. A story about my overall health and well-being. Patterns emerge that help me understand not just how active I've been or how well I've been sleeping, but how my stress levels are fluctuating and how my fitness is improving. And when I compare my data to recommended health standards or to the progress of others in my similar journey, it helps me set more informed goals and understand whether I'm on track to achieve them. This takes me to our point for today. Just as my Apple Watch provides insights into my personal health, SSMC's new data dashboard is really designed to provide insights into the well-being and sustainability of our community. The dashboard aggregates over 90 metrics across 12 categories, giving us a comprehensive view of where we stand as a county and as cities individually. But just like with my health data, these metrics are most powerful when viewed together, over time, and in context. For policymakers and community members alike, this dashboard offers a tool to drive meaningful change. By tracking metrics like greenhouse gas emissions, waste management, economic vitality, and public health indicators, we can begin to see the bigger picture. We can understand not just how we're doing in individual areas, but how these different aspects of sustainability are interconnected. And just like I can compare my fitness data and health standards to help me set better goals, we can compare our community's data to regional and national benchmarks to help us identify areas where we need to improve and set more effective policies to get us there. This dashboard is more than just numbers. It's a story about our cities and our county, where we are, where we want to go, and how we can get there. Now, it is my pleasure to introduce our keynote speaker, someone who knows firsthand the importance of data in guiding decision-making for the health of our community, Dr. Kismet Baldwin-Santana, the health officer for San Mateo County. I've got a few sentences to say about you. Has been a leader in using data to drive public health initiatives that improve the lives of all our residents. Her extensive experience includes serving as interim health officer in San Mateo County and deeply engaging in public health initiatives following her impressive academic journey. Dr. Baldwin-Santana earned her bachelor's degree and Doctor of Medicine degree from Ohio State University. Her postdoctoral research at UCLA focused on gene therapy to reduce the incidence of sickle cell disease. During the pandemic, she completed a master's degree in public health at UC Berkeley. Her commitment to addressing social determinants of health has made her a vital force in improving the well-being of our community. Today, Dr. Baldwin-Santana will share her insights on how data, when used effectively, can empower cities and communities to make more informed decisions that lead to healthier, more sustainable futures. Please join me in welcoming Dr. Kismet Baldwin-Santana to the podium. So you can just click here to advance the slides. Yeah, okay.
I have to say the introductions always sound more impressive than the reality sometimes. Okay. First, I wanted to thank Sustainable San Mateo County for inviting County Health to just come out and speak today. And I love talking about data. So this is right up my alley. And I'll spend a little time today going over, the role of data in health policy. I think the first question is, and this actually has come up, someone has asked me, should we use data to inform health policy? And my answer always is absolutely yes. This is important. And I'm hoping throughout the presentation, I kind of give you some of the reasons why I think we should be using data to inform health policy. I mean, data really plays a significant role in shaping effective health policies. And then those health policies are crucial to public health safety. And I'm only going to speak about health policy today because that's my focus. That's what my career is, but talking about the health of the population. But this really does translate into all sorts of policies for different types of businesses and agencies. Okay, so I think it's worth just taking a moment on what data is, because we say data, we say information. So what are we talking about in health when we're talking about data? And there's different kinds. So there's objective and subjective data. So the objective data is more quantitative. We can measure it. There's a number. There's a number of people diagnosed with diabetes. There's a number of new people diagnosed with diabetes. There's the number of people who have, their mortality rate, who have died due to pancreatic cancer, something like that. So this is something we can measure, and it's quantifiable. It's factual, and most of the time, it's not something where people are going to dispute. Sometimes, I think a good example of a policy based on quantifiable data is, research and clinical science that has looked at tobacco and tobacco policies that have come from that. Okay, these people have smoked, they've been followed over the years. This number has developed, lung cancer or different types of cancer, and it can be linked back epidemiologically to smoking. And so now we need to create tobacco policies to try to prevent that and improve the public's health. So those are an example of quantitative. So qualitative, which I don't think we talk enough about, is the subjective data. These are people's experiences. We're hearing from them in the community, patients, what are their experiences in healthcare system. And it really, I think, captures the human element. And again, I'm not sure we always focus on that enough. There really does need to be a balance between the two. Just throwing out a bunch of numbers is not relatable a lot of times, but if you're bringing in the social, people's experiences and the human context, it really, I think, hits home a lot more. And an example of that would be patients that are, in the behavioral health system. And they're saying, these are our experiences in this system. So let's now create a policy to make those experiences better. When we're talking about data and public health or health, we're using epidemiological data. This is ones where we're looking at, again, new cases or the number of people with something. Diabetes and heart disease comes up a lot. Another version is demographic data, race, ethnicity, geographical location, your age, gender, identified gender, things like that. And then behavioral data, do you exercise? Do you eat, what does your diet look like, where it's more, focused on the behavior. And I think it's worth just mentioning the quote by Mark Twain, and he was ahead of his time, I think, that, data is like garbage. You better know what you're going to do with it before you collect it. And I think that's something that we don't always really think about and focus on. We just want more information. But if we had unlimited resources, that would be great, and time to do that, but we don't. So now we need to think about what data we want to collect, and then what are we going to do with it? What's our next step? To just throw out data and say, oh, this number of people have this, and then not do anything about it? I mean, that's just, not where we want to go with it either. We want to know that we're going to try to make an effort to address something if we come up with if something's identified as an issue. Okay, so that leads us in. So we have the data. How do we use it? And I think the rest of the slides are really going to be on how we can use the data. And then at the end, what are some of the challenges as well to using data for our policies and everything? So setting priorities and goals. This is important. You know, we want to use data to do this. Using things like health indicators. Again, we're going back to life expectancy, infant mortality. This is a really great example, infant mortality. We have data at the federal level, at the state level, and in San Mateo County looking at infant mortality. And it's very clear that Black infants have a higher mortality rate than any other race and ethnicity. And it's significant. It's not a small difference. It's a significant difference. And we can see over time that that's improved, but the gap between Black infants and other races and ethnicities hasn't really improved that much. So what are the policies that we're going to create to try to address that issue? And Black Infant Health Program, we have one in San Mateo County. Not every county actually has one. It's supported by the state and at the federal level. And really that program is meant to provide the resources and help, Black mothers, and then that is before pregnancy, actually it starts, and then follow them after pregnancy and try to make some sort of impact on Black infant mortality in our county and in the state of California. Risk assessment. We use this all the time, data all the time for things like this, especially in environmental health. What's a harmful factor? How are we going to improve public health? So the next thing we're using data for is assessing the effectiveness of interventions. This is so important. Okay, so you have data and you identify something, okay, and then you set a policy, and that's wonderful, or an intervention. Is it working? You can't just set a policy or design an intervention and then not follow it after that, because you don't know if that's really had any meaningful impact. And we use it all the time in our programs in health. We'll take the WIC program, for example, and this kind of, flows into the outcome measures as well. Okay, that's great. Our staff has interacted with X number of mothers and families this year in the WIC program. Okay, so what does that mean? Does that mean we've made any changes? Is that, what is the outcome to that? And so now it's more a step forward. Now we have to say, okay, we have interacted with or contacted this many clients, and the number of moms who are continuing to breastfeed for at least 6 months, because we know that provides many, many health benefits, is this, and it's gone up. So that's a good thing. If it's not, okay, well, what can we tweak to improve that information, that outcome? So it's not about just, again, looking at numbers and widgets, but what are the outcomes that we're trying to achieve, and are we getting there? And if we're not, we have to go back and reassess the intervention and the policy. I don't think we talk about this enough either, using data for resource allocation. Cost-effective effectiveness analysis are not used. I don't hear about it a ton in health, but we should be using it more. Just because something isn't cost savings, because it may not be, doesn't mean there isn't a benefit. And so we need to be able to better and use our data and analyses to show, okay, we're putting money into this, or we're asking you, elected officials, to put money into this. And this is what we expect the benefit to be, or this is what we've already seen that the benefit is. The thing that gets a little tricky here is that, especially in health, you may not see the benefit for a year, 5 years, 10 years, 20 years. We're looking down the road. And it's difficult when looking at the second one here, when you're planning a budget and you're asking people to, fund something and give you money for, whatever intervention you're trying to say, okay, thank you, but you're not going to necessarily see the benefit for years down the road. Just believe us a little bit. and we expect to see something. And I think that's where we need to get a little better at using the data trying to, using analyses to show that we expect some sort of long-term benefit and things that have already happened. For the COVID vaccines in the very beginning, it's a little different situation now, but at least in the county that I worked in prior to here, the county investing money in COVID vaccine administration was actually cost savings, and it was a cost benefit to the county as a whole. There were less people in the hospital. There were less people, who required ICU visits and things like that. So there is a benefit to putting money in, and it's we do need to do a better job of explaining that. And then also, trying not to waste as much as possible. Again, using data to reevaluate our policies and our interventions so that we're not wasting taxpayers, time and money and resources and our staff on something that isn't, moving us along in our health goals as much as we would like. Informing legislation and regulation as much as we can. We try to use data to do this. It provides a factual basis needed for policymakers, and it's grounded in reality. I think we've gotten a little bit away from that, especially during the pandemic, where misinformation is rampant. You could find that anywhere. And there was a lot of talk where it wasn't really factual, but the data was factual, actually. And I think it does provide something for policymakers to kind of hang on to and say, look, this is what we know, at least right now. It reduces some of that uncertainty in decision-making. That also, I think, there was still a lot of uncertainty during the pandemic, for sure. With trying to make decisions and providing a picture of the health trends, but the data was actually pretty clear. And so another one, again, kind of going back to lung cancer, the data linking smoking to lung cancer is pretty clear. And I think it makes it easier for policymakers to say, this is why we want to initiate this, or the number of deaths due to people not wearing seatbelts years ago. Okay, this is clear. We can link it to this. So now we need policies requiring people to wear their seatbelts. Every day, the drugs or medications that people may take, they're using data to inform regulations and policies. The FDA does not make a decision on a drug without having clear clinical trials, outcome information, and data, and deciding whether or not this is a drug or a medication that they think is safe for the public. Again, looking at effectiveness and efficiency, again, these are really going to overlap quite a bit. How efficient are we being? How effective is our intervention? And where should resources be deployed to the best of our ability, with the data that we have? And this really came up a lot during the pandemic as well, improving health equity and fairness. Without the data, you're just kind of thinking, okay, well, I feel like this group probably isn't doing as well, or I feel like this group may need some more resources or something, but you don't really know. And again, it's an opinion, it's a thought, it's a feeling, but the data was clear. There were some groups were being much more impacted than others. And then you've got a story, a very easy story to tell, and a way to move policies and interventions forward in an equitable way. An example of this was, again, I wasn't here during the pandemic, so do not fear, this is not a story from San Mateo County, but we did have an elected official in another jurisdiction who was like, we're not getting enough testing here. There's not enough testing, and we really need this and we really need that. And then when we looked at the data, we were like, we've got testing centers all over your area, but people aren't coming. It's not that there isn't testing available, it's that they're not coming. So maybe the new direction should be, how do we get people to those sites? or maybe those aren't the right sites in your region. Where should we better place those testing sites? But it's not that there isn't testing available. That's just not the case. So this really helps with framing, again, the conversation a little in more fact than conjecture. Also looking at things like social determinants of health that play into our health and well-being, really looking at the data there. We know that your zip code matters. Your life expectancy is different depending on where you live in the same county. And your educational attainment can be different based on, what by demographics, by geographical location, how much you're able to make. Your salary is also dependent on multiple different things. And we really need to look at the data, because if we're just having a conversation and trying to set policies and move things forward based on just one thing, you're not looking at all of the other factors that are at play. Again, going back to enhancing accountability and transparency, again, this comes up a lot for health. Transparency. Why are you telling us to do something? And we are way past the time where we can say, just trust us. That probably was, fading before the pandemic, but it is totally gone now. The level of trust that the community has in health and maybe in public health, more specifically, is low coming out of the pandemic. And so we really have to do a good job and use the data that we have to be transparent in why we're making decisions and why we're asking people to do things, or why we're saying this policy is necessary. And it needs to be public as much as possible, that data that we're using, not just, okay, well, we saw the data and this is why. This is the data. You take a look at it yourself. Is that what you're seeing as well? We really have to continue doing that because, again, the public trust is low. This kind of, again, plays into addressing complex health issues. There's so many aspects. If there's something that's multifaceted, like a pandemic, you want to have all of the data that you can, and you want to be able to give that to the policymakers so that they understand where we're coming from and what we're asking for. It helps with long-term planning. Where were we? Where are we now? Where are we trying to get to? And, at the state level, it's really nice. They have modeling teams now where they're actually trying to predict what's going to happen. Where is this going to go? We get this for things like the respiratory viral season. Okay, what is flu going to look like? They think in the next, week or a month or 2 months. Do we think those levels are, cases are going to go up? Do we think they're going to hold steady? Do we think they're going to go down? What does that look like? So that helps us kind of not predict, but plan ahead of time and in advance. And so that was also used quite a bit during COVID for hospitalizations and things like that, based on, okay, this is the percentage of the population that has been vaccinated. So hopefully reducing, severe illness. This is the percentage that is over this age, which has a higher risk. This is the percentage, of X, Y, and Z. And we put all those things in together. This is what we think is going to happen. Best case scenario, mid scenario, worst case scenario. And so we can look ahead and try to plan. And this is really important. I think the more that we can start to model out and look ahead, it's going to be key to making plans. Data allows us to be adaptive as well, as much as we can. If we have to make real-time decisions, it's nice to have data. Unfortunately, we don't always have real-time decisions. Real-time data. So we have to use our best, educated guess sometimes. So in the end, what are some of the, oh gosh, I think, let me go back one more. There is an ethical responsibility as well. We should be using data to guide our policies. We shouldn't just be using our opinions and our thoughts and our feelings and our emotions to guide what we're doing for communities. We have to get their input, number one. I think it was the disability community that had the slogan of nothing about us without us. And that should be for every population in every community. You know, you have to have representatives from that community to inform and see the data and, you know, and provide their input so we can move together, you know, in a way that makes sense for that community and is socially responsible and is in the best interest of that population in the county. So kind of one of my last slides, challenges of using data for policy. Data is great, but number one, we don't want to over rely on it either. We want to have the data, but again, we need a social and ethical considerations being, you know, taken into the thought and the development of policies and not just numbers, because numbers don't tell the story all the time. So we really need to have, you know, to not over rely on it, but rely on it just enough, which is a fine line sometimes. The data needs to be accurate. It can't be, you know, frankly, trash data. And sometimes it is. I mean, you see stuff and then you look further into it and you're like, where did they get this from? Who did they talk to? What sources do they have here? This doesn't make any sense whatsoever. So you need to know that it is accurate data as well. And there's always the risk of, you know, misinterpretation or frankly, cherry picking data. That happens all the time. Okay, this is what I think, and here's the data to support that. But all of the other data that's out there that doesn't support that, I don't really believe that so much. I mean, it gets cherry picked all the time. So we need to make sure that we're trying to not do that to the best of our ability. And kind of going back to the over-reliance on data, you can't have the assumption that because something isn't being shown that everything's okay there either. This happened, I know it happened during COVID, and it continues to happen sometimes where, say, a population is a small percentage of your jurisdiction. I can give a good example in San Mateo County, like the Pacific Islander population. Small, but mighty, but their numbers are small. And so in data and representing that, they're not always going to be represented on those graphs and in the data. Because when you have small numbers and you don't want to, you run the risk of overstating something. Do you know what I'm saying? Or understating something. Oh, we're not really, let me give an example. Okay, if there's 5 people in the community and 2 people have a condition, you're like, wow, that's a lot. They've got a high percentage of people that have this condition, but it's only 5 people total. I mean, do you know what I'm saying? So you can't make as much of a statement when you have small numbers. And ethically, we don't want to put data out there sometimes where it is a small number and we don't feel like we could make a clear statement on it. But doesn't mean there isn't something happening. And so you may not see it, so you don't think about it, and there's an assumption that there's nothing that needs to happen there. And I think that does happen more often than we would like. So again, over relying on just what you're seeing too is a bit of a balancing act. We have to balance objective and subjective data. We love numbers in health. We love a dashboard. We have dashboards. We like looking at other people's dashboards. We use them all the time, but we cannot, you know, underestimate the actual lived experiences of people. And that has to be, you know, brought in to the data and how we're considering a policy or an intervention. And we need to make the data relatable. This happened a lot. This happens a lot in health. This happened a lot during COVID, where we're spitting out numbers and it's not relatable to people. It's just, okay, what are you trying to tell me? This makes, you know, this does not affect me, but it does. And so how do we, you know, reach individual people, but then also populations and make that data relatable to them? And so, I mean, the takeaways really are using data to inform policy decisions is essential. It is. That's the bottom line. We need to use both objective and subjective data, and data should be used as a tool to guide policy, but it really has to be contextualized within broader frameworks. And again, I'll leave you with Sherlock Holmes, who said it's a capital mistake to theorize before one has data. Insensibly, one begins to twist facts to suit theories instead of theories to suit facts. So we're going in with a conclusion already. We look at the data, and then we run the risk of, moving, really not considering the data that doesn't support what our theory is already, and overusing or emphasizing the data that we do use, we want to support our theory. So we really need to go in with an open mind, see what the data is telling us, and then, create our policies and our theories and our interventions based on that. And that's what we try to do to the best of our ability. And that's it. So.
We'll have time for Q&A after the other couple of presentations. Thank you so much, Dr. Kismet Baldwin-Santana, for your presentation and for discussing some of the challenges and opportunities and the nuances related to data. Very important message for our community to hear. I'd now like to introduce SSMC's program manager, Simona Vallone. Simona is a sustainability scientist with a background in food and agricultural science. She has research and management experience in both academia and food technology startups in the Bay Area. Her work has focused on improving the sustainability of the food system by addressing a broad range of issues, from understanding how plants tolerate heat and drought stress, to reducing food waste and loss, and improving plant-based nutrition through market and policy interventions. She has been instrumental in developing SSMC's new sustainability dashboard, and today she will introduce it to you. Please join me in welcoming Simona to the podium.
Good morning, everyone. Thank you for joining us. I'm really excited today to introduce you to the new user-friendly dashboard that we recently launched, designed to empower local governments, community organizations, and community members with the latest, most relevant sustainability metrics for the 20 cities and many unincorporated areas in San Mateo County. We have heard from Dr. Baldwin-Santana and from Sarah about the importance of data in making informed decisions. We are all aware that we are in a time of data abundance, but often what is in short supplies are the time and resources to find, collect, and visualize effectively the data in a meaningful way. That's where our dashboard comes in. Our dashboard is a centralized place to find the basic metrics for assessing needs, planning solutions, and writing grants or track progress. Regular updates are built into the design of the new dashboard, making it easy for us to maintain it and ensuring the information stays relevant and up to date. We include data that spans across environmental, social, and economic dimensions. As Sarah mentions, the data aggregates over 90 metrics across 12 key topics. There you'll find metrics on energy, transportations, housing, and climate actions, and much more. To ensure that the data we provide is both useful and reliable, we have established key criteria for the selection. In general, the data must be available for all 20 cities and possibly for unincorporated places. It should also be available for multiple years so that we can see changes. Data must be comparable across time and jurisdictions, and should be updated regularly by the releasing source. And data and the source might also be reliable. So here are some of the main sources that we use to get our data from. And I'm sure many of you are very familiar with the idea and understanding the importance of context to ensure insights are accurate, reliable, and relevant and actionable. On the dashboard, the metrics are displayed on a map, making it easy to compare across cities. But it's important to remember that accurate comparison requires taking into account factors like economic conditions, demographics, and geography to connect with what Dr. Bolden Santana was saying. For instance, if a city shows a low bike usage, we need to consider that whether factors like hilly terrain make biking more difficult. Without the context, we might misinterpret the data as a lack of interest or infrastructure, when in fact, geography plays a key role in shaping transportation choices. Now I'd like to show you a short video that demonstrates how the dashboard works.
Hi, SSMC's Sustainability Dashboard is an easy-to-use tool to get insights into each city's progress building a sustainable community. In this video, we'll show you how it works. The dashboard includes 12 sustainability topics and over 90 metrics. To find the metric you need, use the drop-down menus to browse the available metrics. You can also search for a metric. Click into Select a Metric. On PC, press backspace. On a Mac, press the delete key. Then, type a keyword for the metric. You can also look at data by city for unincorporated areas or drill down by census tract. To use an interactive map, hover over any city on the map to see the name and the current value. Notice the corresponding trend line in the right chart, which turns black. For a comparative analysis, click on 2 or more cities on the map. This will highlight the cities on the chart for you to compare their trends over time. The dashboard includes from 6 to 16 years of historical data for each metric. Discover how your city is performing compared to the county average. Look for the yellow box for a detailed description of the metric and its sources. For further analysis or to share progress, you can download data as an image or CSV file or copy the URL to the chart. Use the dashboard to know what's happening in your city and across the region. How many childcare programs are there in your city? How many families have income lower than 30% of the county median? Which city has adopted a REACH code ordinance? How many solar panel permits were issued? How many renter units use gas as their primary heating source? And much more. We hope you can use the dashboard to accelerate your sustainability efforts. If you have any questions or comments, drop us a note. We'd love to hear from you.
We'll dive in now with a few real-world examples that highlights the power of this dashboard. These scenarios that I'm about to present are really just ways to demonstrate its practical benefit, the versatility in addressing the wide range of needs. For example, our dashboard could be used by the sustainability department in the county to identify which community might benefit the most from educational campaign about green transportation. The dashboard provides easy access to key metrics that can guide these efforts. This includes, for example, metrics on demand and supplies of EV chargers with number of electric vehicles and also the public charging stations, the average duration of a commute by and the percentage of commuters that use public transit, bike, or drive alone. By using the dashboard, the department could identify the percentage of population in each city relying on cars for their commute. They could also look at the daily miles traveled per commuter to identify the communities that are driving the most. And it can also find where in the county drivers have the lowest number of electric vehicles. So note that the dark shades of blue always indicates high numbers. By comparing these maps, the department could quickly identify the areas that could benefit the most from green transportation campaigns. Another example is city staff using our dashboard to understand how the community is engaging with renewable energy and then fine-tuning their outreach or incentive programs accordingly. Some relevant metrics included are, for example, total number of battery permits pending or completed, total number of housing occupied by owners, income, By using the dashboard, the city could identify the total number of solar permits that have been completed or pending in their city. They could identify total number of housing that are occupied by owners, considering that this data is also available at the census tract level to get really a more granular view. They could also look at the income metrics to identify neighborhoods that might benefit the most from additional incentives. In this case, we are looking at a household with income lower than 300% of the federal poverty level, which is the threshold that's used for housing and nutrition assistance, particularly relevant in a high living cost of living in this area. All these metrics combined could help identifying where financial incentives might be most needed to guarantee an equitable and green energy transition. Another use case are community organizations. Community organizations dedicated to tree planting, for example, could utilize our dashboard to identify locations where their effort will have the most significant impact on community health and well-being. Some of relevant metrics include percentage of trees, but also health-related data such as asthma rates. This could be useful if we want to target communities that have high asthma prevalence, considering the tree coverage can help improve air quality. And also include owner-occupied housing units to determine areas where residents can be more invested in long-term improvement and maintenance planted trees. The map here shows the area of a city with the different percentages of trees. The census tract level, which is what's shown here, can be very helpful to get a more granular understanding of the need. The organization could also inspect the household income data to identifying lower income communities that might lack access to trees. From comparing the two maps, one can see that the area with less trees is also home to a relatively larger economically insecure population. By providing concrete evidence of need and potential impact, this data could help organization recruiting volunteers and also increase fundraising efforts. Lastly, the dashboard is a powerful tool for community members that wish to stay informed and engage with sustainability efforts in their town. By using the dashboard, community members can monitor, for example, emission from building and transportations, electricity and gas consumption at the residential level, and also risk of droughts or wildfires. Community members interested in climate action of their city could have access to a chart like this that shows if and when their city adopted or updated their climate action plan. They can also track emission from residential and commercial buildings in their city to understand impact of and efforts of increasing energy use efficiency. They can also see how commuter-related emission have changed over time in their cities and across the county. This tool empowers community members to participate actively in local sustainability effort and increase awareness of the challenges that we face. Whether you are a county or city officials or staff or a community organizer or a member of the community, the dashboard can help a stronger sense of agency and empowerment by showing that our actions truly might make a difference in shaping our community's future. And now, some of the community members and Sustainable San Mateo County partners will share their experience on how they use their data in their work and how they might use our dashboard in the future. So first up is Jeremy Levin, Policy Manager for the Housing Leadership Council in San Mateo County. Please welcome Jeremy.
Amazing. Good morning, all. I don't have any slides today, so you're just going to have to enjoy the sound of my silky smooth voice. I'm so happy to be talking today to Sustainable San Mateo County and all the supporters. As Simona mentioned, my name is Jeremy Levine. I'm the Policy Manager for the Housing Leadership Council of San Mateo County. And the Housing Leadership Council's mission is to work with communities and their leaders to produce and preserve quality, affordable homes. Now, as part of that mission, as the policy manager of HLC, one thing that I've done over the last 3 years has been to work with every community in San Mateo County to update their housing elements. I've got a little interactive portion of my speech. Who here knows what a housing element is? Raise of hands. All right, so that's most of the room. Who here has read a housing element? Yeah, it's a lot less, right? Not nearly as many people. So, I mean, but all the electeds in the room, I hope. So, housing elements, for those that are not familiar, are essentially a story, a set of data about the housing needs of a community, the constraints to meeting those needs, the fair housing impact of the policies, and all of that data funnels down into a set of policy changes that are supposed to make it easier to meet the housing needs, present and future, of everyone who lives in that community. Now, housing elements have so much data that almost nobody here has ever read any of them. A housing element can be 500 pages. Redwood City's housing element is as long as Moby Dick. Menlo Park's housing element is longer than War and Peace. But at the end of the day, policy in a housing element derives from data. The data is what informs the policy. And all too often, when communities are discussing data, when communities are discussing policy, they're operating without access to all of the data that might inform that. The data might be there. It's in 500 pages of a housing element, but nobody is reading 500 pages of a housing element. The data is in documents that are esoteric. The data is not accessible to the vast majority of our communities. And so the data is siloed, and people make decisions that are not informed by what is known. What Sustainable San Mateo County's dashboard does is it takes data from so many areas that matter, from health, from the environment, from the economy and poverty, and all these different, I guess a dozen different categories, and it funnels them down and translates it into a way that can be easily understood, that can be visualized, that a person who doesn't have the time or the resources to read through 500 pages of a housing element can actually understand. And that data, the data that translates into policy, is how we change lives. Because policy at the end of the day is what really defines how our communities work, who our communities serve. And if policy derives from data, then data is the foundation of all of those changes that we make. So I'm extremely excited to be using Sustainable San Mateo County's dashboard to tell the story of housing in a way that more people can understand, to connect housing to the environment, to the health of our communities, to the sustainability of our planet. And I am excited to have so many people in a room from so many different areas of policy and advocacy together to talk about that data and to celebrate this amazing resource that's been created. So thank you, Sustainable San Mateo County. I will pass it off to our next speaker, Avi from Menlo Park.
Yes, now we're going to hear from Ori Paz, from management analyst from the city of Menlo Park. Thank you.
Nice.
All right.
Okay.
Yeah.
All right. Thank you, Simona, and thank you, Sarah, for the invitation, and thank all of you for sharing your morning here with us to talk about this exciting dashboard and all of the uses. And so to build off of what Jeremy was saying, and my lovely introduction, I'm a management analyst with the sustainability division, and I use data to inform collaboration to implement the policies that were driven by the data. So for a little bit of historical context, in 2020, the city of Menlo Park adopted an ambitious climate action plan with the goal of achieving zero carbon by 2030. That was defined as a 90% reduction from our 2005 levels and removal of the remaining 10%. We were focused in our implementation scope in 2021 to 6 key strategies related to increasing electrification in existing buildings, increasing the number of EVs on the streets, improving access to charging for multifamily and commercial properties, reducing VMT from cars, taking responsibility in eliminating municipal operation emissions, and developing a climate adaptation plan. And as we were working on all of those, we continued to use data to inform where we were focusing, how we were using staff time, and tracking our impact. Over the past year, there's been a huge effort in partnership with our Environmental Quality Commission. I see a number of our commissioners here today, so that's exciting to give them a lot of good credit for the work that they helped us do in investigating what we were going to do for the remaining 5.5 years of our planned timeline. And I'm happy to report that just last week, the City Council adopted our 2025 to 2030 implementation scope of work. And you don't need to try to read any of these really small things. They're available in the staff report. But the key here that I want to highlight is that all of these action items that are reflected in the adopted scope of work are the result of a lot of research by commissioners who were appointed to subcommittees, by staff, and then taking that data, we used it to inform the conversations and discussions and discuss, okay, these are all of the options of things that we can do or could do. What is our capacity? Where are our resources? And what is the impact that we could make? And where do we want to see that impact reflected in our action plan? And so data really is the foundation of the policy, and it's that key piece of informing those conversations that allow for effective collaboration. Because without collaboration, we're not going to be able to implement any of these lofty and really powerful policy goals that we have, because in the end, they need to be implemented. And so I did want to just celebrate, having data that is accessible really gives people an opportunity to engage in the process. It strengthens our volunteers and our advocates and staff, and really extends our reach in saving us time and making it more efficient to bring that data to the conversation. So we're not just people talking with an opinion. And then we can also start to look from the context of the different people who are coming into our partnerships and really leverage their perspectives to start talking about the co-benefits of the work that we're doing, right? Like, we have an opportunity now, and I think it's really exciting to see folks from health and housing in the same conversations with climate, because, I think we've had a bit of a messaging problem over the last 30 years, focusing on impacts in 100 years. But now, as we start to look at what are the impacts to people today, there's a lot of positive that can be done through climate action for folks today. And a lot of that is around electrification and reducing emissions to improve air quality and improve health outcomes, especially in historically disadvantaged communities. And so I did want to just highlight quickly and quickly plug our home upgrade program, which is data in action, right? So it was looking at a lot of data sources, which would have been easier had we had a dashboard, to inform a program that's aimed at electrifying a community that has not seen the same benefits as some of the other communities as it relates to electrification. So we were fortunate to get money from the CEC through Senator Becker's office, and partner with PCE, or Peninsula Clean Energy, to launch this zero-cost full home electrification program. It's going to be direct install for income-qualified residents in the Bellhaven neighborhood. And so if you are connected with anyone who may qualify or who is interested, we have soft launched. We're reaching out to people on that wait list, and definitely reach out because we want to reach as many people as we can. And really use, all of the hard work that went into setting the policy, all of the hard work that went into defining these programs, and all of the hard work that's, now going into implementation, so that it can actually have a meaningful and measurable impact in the places that need it. And in closing, I just want to say thank you again for the invitation to speak to everyone, for your hard work in this space. And yeah, I'm excited to track the impacts of all of our collective efforts using this dashboard and others like it into the future, which is hopefully brighter because of our work. Thank you.
Thank you so much, Jeremy and Ori. Now we've got just a few more things to do before we wrap up. I would like to introduce Molly Carter, our Communications and Outreach Lead. I think we're behind.
Okay, so I don't know if you saw the trivia questions, and they're not trivial. So we're actually not calling it trivia, we're calling it test your knowledge. But they are on your table. If you haven't had a chance to look at those, that's okay. We'll do it in real time. So our first question is, what are the average daily miles per car commuter in San Mateo County? 26 miles, 34 miles, or 46 miles? Anyone have a guess? 34, 46, 34. Okay, well, some of you are correct. 34 miles per day. So this is one of several metrics we have in the dashboard that is related to commuting behavior, including we have data on modes of transportation. But what's really interesting here is the very big range across cities. So you can see it, well, I don't know if you can see that. It ranges from 25 miles per day all the way up to 60 miles per day. And you'll see a little drop off there at the end. That is during the pandemic. So lots of stories to be told through that data. Okay, next question. Which city had the biggest drop in building emissions per capita from 2017 to 2022? And this includes emissions from residential and commercial buildings, their gas and electricity use. Belmont, Brisbane, or South San Francisco? Okay, I'm hearing all three. So some of you are right. It's B again, Brisbane. So between 2017 and 2022, Brisbane actually lowered their emissions from 2.5 to 0.8 metric tons of CO2 equivalent per person. So that's a huge drop. And so we think we can find these kinds of examples in the dashboard. And of course, we need to apply context. But we can use these to go look and see, what did Brisbane do and what can other cities do? I will mention that Belmont and South San Francisco also reduced their emissions, just not by as much. Okay, third question and last question. What is the percent of housing units in San Mateo County that are renter occupied? What? 42, 28, okay. And this is an example of demographic metrics that we have in our dashboard. And this is all about how do we combine demographic data with some of the sustainability metrics. We think combining those can be really helpful, as you've heard from some of the other speakers. And in this case, we think this kind of demographic data is really interesting because applying electrification, other sustainability efforts is going to be really different for a renter population versus people who own their houses. So the answer is 42%, which has been quite stable over time. And one thing about this, you heard from Simona earlier, we also have census tract data on this. So when you dive into the census tract, very interesting. You get a really different view on this. And people often make a lot of assumptions about our different cities. So for example, there are several tracts in Burlingame that have over 50% renters. There are several tracts in Menlo Park with over 70% renters. So it's good to dig in and really understand the data. So thank you for playing along. I will keep things moving. To finish, couple announcements. We have upcoming events. There's a list of them on your table. September 16th, we have an online webinar about alternatives to freeway widening. On October 17th, we have another webinar about electrification. It's a new electrification program with incentives from PCE. Peninsula Clean Energy. And on October 24th, we're going to have another in-person event. This is going to be the launch of our indicators report, which this year is focused on EV charging infrastructure. So you have details on your tables. There's URLs and QR codes you can scan to register, and we would love to see all of you back. Okay, couple final announcements. First, thank you all for being here. Thank you to all of our speakers for your insights. Really helpful today. And thank you to CZI for hosting us here today. Two things. September is Sustain SSMC month. So it actually takes thousands of hours to put together our core programs, including the dashboard that you just saw. And these are all used to educate, inspire, promote policy adoption, and hold our cities accountable. We can't do this without your support, so we're just asking if you can to support our efforts by using the QR code that is at your table. There are also little envelopes. So this is our pitch for your support. So thank you for that. And if you can follow along this month, our email newsletter, which you can sign up to on our website or our social media channels, we're going to be giving you a behind the scenes look at all of our core programs and what goes into creating those and the impact that they are having. And then finally, we would love to get your feedback. We learn every time we do an event like this, and we would love to hear your thoughts on the event and on the dashboard. So you can scan this QR code, or there are forms at your table if you want to use the form to just give us your feedback. Feedback is a gift, so we thank you for that. And I think that brings us to the end.